Hi, good morning. This is Teacher Talia, your grade 5 teacher. Before we start our lesson, let's begin with a prayer. Lord, help us to listen with open minds and heart as we begin our mind, body, and spirit. Help us to learn the skills necessary to build healthy relationship with our families and friends as we follow your Son, Jesus. Amen. Our lesson for today is all about the common ailments and proper care of the urinary system. But before that, let's define first the urinary system. So the urinary system is also known as the renal system or urinary tract. It consists of the kidneys, ureters, bladder, and the urethra. The purpose of the urinary system is to eliminate waste from the body. Here are the common ailments of the urinary system. The first one is the nephritis. So what is nephritis? Nephritis or Bright's disease refers to the disease in which the kidneys are seriously damaged and partially destroyed by an inflammatory process that originates from the infection of the glomeruli. In acute nephritis, the kidneys are large, swollen, and fat congested. These are predominantly a disease of the youth. In children, it usually develops with an acute upper respiratory tract infection like tonsillitis. The second one is the kidney stones. The kidney stones are formed inside the kidneys and can cause great pain if they slip into the ureter and remain there, blocking the passage of the urine. Kidney stones are mainly caused by infection, blockage, concentrated urine, too much calcium and vitamin D. Stones may also go down the bladder, stay there, and grow larger. Symptoms are suddenly agonizing pain at the back, usually on the affected side, profuse sweating and even collapsing, high fever, and often violent vomiting with difficulty in urinating. The third one is diarrhea. All of the clinical disorders resulting from disturbed kidney function, uremia is the most spectacular and dreaded. This is the inability of the kidneys to remove waste product. As a result, this waste accumulate in the blood and poison the body. The next one is the urinary tract infection or UTI. The female urethra is quite vulnerable to bacterial invasion. In women, the organism can migrate from the intestine to the bladder and infect the urinary tract. Some signs are difficulty in urination, back pain, and fever. The last one is the tumor of the bladder. Benign tumors of the bladder wall are rare. They give rise to bladder irritability and hemorrhaging. In children, sarcoma is seen most often, and the most rapidly fatal of this bladder neoplasm. Carcinoma is the most common tumor of the bladder. This is fatal if not removed because they are interfere with bladder function. Here are some ways on how we can take care of our urinary system. The first one is drink plenty of water. A healthy adult needs about 6 to 8 glassful a day, or somewhat less when we take sufficient quantities of other liquids. We may need more after sweating from active sports or on a hot, dry day. Water is needed to dilute waste from our blood. The second one is avoid eating too much high sodium foods. Salty foods can make urine concentrated and may cause kidney stone. Junk foods and processed meat contain lots of salt and preservatives. The third one, eat a lot of fruits and healthy foods. Fruits and vegetables contains lots of vitamins and minerals that are badly needed by the kidney to function normally. A proper diet makes all parts of the urinary system healthy and protects from all infectious diseases. The fourth one is we need to take a lot of rest. Pupils like you are exposed to stress created by school, family, and friends. Always bear in mind that resting, relaxing your mind as well as all parts of your body, 8 hours of sleep are necessary at your age. So that's all for today. Goodbye. Thank you for listening.